What causes overuse injuries in plyometrics for athletes? Have you ever wondered why some athletes experience injuries from plyometric training? It's a common concern, especially given the explosive nature of these drills. Let's break down the factors that contribute to overuse injuries in plyometrics. Overuse injuries primarily occur due to repetitive mechanical stress on muscles, tendons, bones, and joints. Plyometric exercises involve high-impact movements like jumping and bounding. These activities generate significant forces, particularly during landings. When athletes perform these movements repeatedly without enough recovery time, micro-trauma can build up in the tissues, leading to injuries. One major factor is excessive training volume and frequency. If athletes perform plyometric exercises too often or with too many repetitions, they increase the cumulative stress on their bodies. Without proper rest, tissues do not have time to heal and adapt. This can lead to conditions like tendinopathies, stress fractures, and joint pain. Another important aspect is having an inadequate strength base. Athletes who lack foundational strength may struggle when they begin plyometric training. If their muscles are not strong enough, it can impair their ability to absorb shock and control their landings. This increases the strain on their tendons and joints, raising the risk of injury. Poor technique and form also play a significant role. When plyometric drills are executed incorrectly, such as landing with knees collapsing inward, the risk of injury rises. Proper coaching and supervision are essential to ensure athletes use safe movement patterns. This helps minimize joint stress and effectively distribute forces during exercises. Rapid increases in intensity or complexity can overwhelm an athlete's ability to adapt. If an athlete suddenly increases the difficulty of their plyometric training without a gradual progression, it can lead to overuse damage. Inadequate recovery and rest are critical as well. Overtraining without sufficient rest periods can hinder tissue healing and adaptation. This can result in chronic inflammation and micro-tears in tendons. Lastly, sport specialization can contribute to overuse injuries. Athletes who focus on a single sport with repetitive plyometric demands may experience higher injury rates. Cross-training can help promote balanced development in the musculoskeletal system. To manage these risks, athletes should establish a solid strength and conditioning foundation before starting plyometrics. Emphasizing proper technique with expert supervision is key. Gradually increasing the intensity, volume, and complexity of plyometric exercises is essential. Incorporating adequate rest and recovery periods allows tissues to repair. Finally, using plyometric exercises as part of a balanced training program can help reduce repetitive stress on the same tissues. By addressing these factors, athletes can minimize the risk of overuse injuries while still benefiting from the power and explosive strength development that plyometric training offers.